today we are going to learn about the lymph drainage of the head and neck. The objectives are to describe the arrangement of lymph nodes of the head and neck region, then to describe their drainage, the lymph drainage, and to discuss some of the clinical correlations. So we'll be looking at the group of nodes, their drainage areas, the pathways, and the clinical correlations. So first we will look at the groups of lymph nodes. If you look at the lymph nodes of the head and neck region, so there is a horizontal group like this. It's like a collar around the neck, extending from the tip of the chin, the jaw, to the back of the head. And there's a vertical group along the neck, right? And there's a mucosa associated group in the naso and the oropharyngeal region. So this is inside. You have the pharynx like this, right? This is the nasal cavity, the nasopharynx and the oropharynx. In this region, you have another group called the mucosa associated lymph nodes or the Waldeus ring. So there are mainly three groups: the horizontal group, then there's the vertical group, and there's the mucosa associated lymphoid tissue. You can shorten it as small. You may remember from the GI module as well. You had in the intestines, related to the intestines, you had lymph nodes in the mucosa. So here you see a picture which shows the horizontal and the vertical groups of lymph nodes. Okay. So now we will look at the, first we will look at the horizontal groups of lymph nodes. They are situated at the craniocervical junction, that is between the head and the neck, right? So these lymph nodes are situated in this area. Most anteriorly, just below the chin, you have a type of lymph nodes called submental lymph nodes. Here. And then related to the submandibular gland, you have the submandibular group of lymph nodes. Then in this area, related to the parotid gland, you have the parotid lymph nodes, so the pre-auricular. So you have the ear in this area. You have the ear like this. So anterior to the ear, it's called the pre-auricular lymph nodes. Then behind the ear, you have the mastoid area. And here you have the mastoid lymph nodes. So this is also called post-auricular or the retroauricular lymph nodes. Then at the most posterior part of the scalp, above the occipital area of the scalp, you have the occipital nodes, right? And in addition, on the cheek, you may have a lymph node called the buccal lymph node. Okay, so here I have included a picture, right? Okay, so here you can see the submental nodes, the submandibular nodes, the preauricular or the parotid nodes. Then behind here, the retrocervical or the post-auricular, sorry, the retroauricular or the post-auricular lymph nodes, also called the mastoid. And then at the back of the head, you have the occipital lymph nodes. Do any of you know who this is? It's fine. You are not expected to know him. He's a German anatomist known as Waldeyer. He has done many things like naming the neuron theory and the chromosomes. I inserted him here because he is the first person to describe the lymphoid tissue in the nasal and the oral pharynx. He described that they were arranged as a ring in the pharyngeal region. Okay, so now we will look at the Woldayer's ring. So if you look at the sagittal section, sorry, I use a red pen. So you have the nasopharynx like this, the oropharynx like this. At the top of the nasopharyngeal region, you have a group of lymph nodes called the pharyngeal lymph nodes. And then to the nasopharynx, you have the opening of the eustachian tube, the auditory tube. Right? This opens into the middle ear. And related to this opening, you have a group of lymph nodes called the tubal lymph nodes. Then related to the palate, you have the palatine tonsils, and then you have the tongue here, and in the most posterior part of the tongue, you have the lingual lymph nodes. And if you look at this from the anterior aspect, if this is the this upper area is the nasopharynx and this lower area is the oropharynx. This area, right? So at the topmost area, you have the pharyngeal tonsils, and on either side, related to the opening of the eustachian tube, you have the tubal tonsil, then the palatine tonsils, and at the base of the tongue, you have the lingual tonsils. So you can see these are arranged as a ring. So that's why it's called the Woldayer's ring, named after the person who first described this arrangement. So here I have included some pictures. Here you can see the pharyngeal tonsil, tubal tonsils, palatine tonsils, and the lingual tonsils. This is the anterior view. You can take a look at these pictures and understand how they are arranged. Okay, so then we come to the vertical group of lymph nodes, right? So if you so this is the neck of the person, right? So the vertical group is associated with the veins of the neck. In the anterior aspect, you have the anterior jugular veins and the external jugular veins. So these are the superficial veins. Arranged along these veins, you have the superficial cervical lymph nodes, right? And then more internally, more internal to the sternocleidomastoid muscle, you have the internal jugular vein, right? It joins more internally. So arranged along it, you have the deep cervical lymph nodes. So these deep cervical lymph nodes drain all the other areas. So all the superficial cervical, these nodes, and the horizontal group, all these finally drain into this deep cervical group of lymph nodes. Okay, so this picture shows the superficial cervical lymph nodes. Okay. Yeah, this is the anterior, these are the anterior jugular veins. Along them, you have the anterior superficial cervical lymph nodes, and this superficial to the sternocleidomastoid, you have the external jugular vein, and along it, you have the external superficial cervical lymph nodes. And here, more internal to the sternocleidomastoid, you have the internal jugular vein. And along it, you have the deep cervical lymph nodes. These deep cervical lymph nodes, you can again divide as superior deep cervical and the inferior deep cervical. So here, you see the deep cervical lymph nodes. This is the internal jugular vein, and along it, you have the deep cervical lymph nodes. And when you consider these deep cervical lymph nodes, there are few important lymph nodes that you should know about. First, there's the jugulo-digastric. This is situated behind the posterior belly of the digastric. This is the digastric muscle. So it is situated behind the posterior belly of the digastric in front of the internal jugular vein. So that's why it's called the jugular, because of the internal jugular, and digastric because it's related to the digastric muscle. So here you have the jugular digastric muscle, and it drains the tonsils, the palatine tonsils, and the tongue area. This area drains into these jugular digastric nodes. And if you look at this, the surface marking, you can feel it behind the angle of the mandible. So it is easy to palpate it here behind the angle of the mandible. If you can feel it on yourself, you can you be able to feel it. Then the other one is the jugulo-omohyoid. It is related to the omohyoid muscle, the intermediate tendon of the omohyoid muscle here, and also posteriorly there is the internal jugular vein. So again, it's related to the internal jugular and the omohyoid. So that it's called the jugulo-omohyoid node. This node is important because it drains all the lymph of the tongue. So all the lymphatics of the tongue drain through this jugulo-omohyoid lymph node. Okay, so if there's any disease of the tongue, this jugulo-omohyoid will be enlarged, and you may be able to feel it in the lateral aspect of the neck. Then another group is the supraclavicular lymph nodes. It's situated above the clavicle like this. Right? You can palpate it over the clavicles. So these are important because they are enlarged in diseases of the thorax and the abdomen. You may already know, right? If there's disease of the stomach, gastric carcinoma, you will be able to feel these supraclavicular lymph nodes if it has spread along the lymph nodes. So here also I have described the jugulo-digastric and the omohyoid nodes. Here you can see the jugulo-digastric node, and here the jugulo-omohyoid node. This one is a bit deeper, actually more internal to the sternocleidomastoid. So it's a bit difficult to feel unless it is significantly enlarged. Right? Then you have the deep visceral lymph nodes. So here, if you take the deep visceral in the visceral structures of the neck, you have the hyoid. So you have the hyoid, you have the thyroid cartilage, the cricoid, and then you have the trachea with the tracheal rings. If you look at the lymph nodes associated with these structures, there are a group of lymph nodes below the hyoid bone called the infrahyoid lymph nodes. Then there are prelaryngeal lymph nodes in front of the thyroid. And then, in this area above the cricoid cartilage. And then in front of the trachea, you have the pretracheal lymph nodes. And on either side, you have the paratracheal lymph nodes. So in these diagrams, you can see, right? The infrahyoid ones are not shown here, but they should be situated in this region. And then the prelaryngeal, the thyroid, and the in front of the thyroid gland, and the pretracheal lymph nodes in front of the tracheal rings. And on either side, you have the paratracheal lymph nodes. So these also drain to the deep cervical lymph nodes. Then behind the pharynx, and the you have the retropharyngeal lymph nodes. So if you have the pharynx like this, you have the vertebral canal like this. In this region, you have the retropharyngeal lymph nodes. Right? So this is the posterior aspect of the pharynx shown here. So behind the pharynx, you have the retropharyngeal lymph nodes. So this summarizes all the lymph nodes of the neck, the head and neck. Right? You have the horizontal group, the mucosa associated group, and the vertical group. If you look at the horizontal group, it's found at the craniocervical junction. You have the submental, submandibular, preauricular, postauricular, and occipital nodes. And in the mucosa associated, you have the Walde's ring. In the vertical can again be divided into superficial cervical, related to the external jugular vein and the anterior jugular vein, and the deep cervical related to the internal jugular vein. And you have some special lymph nodes called jugular digastric, jugular omohyoid, and the supraclavicular. And in the deep cervical, deep visceral group, you have the infrahyoid, prelaryngeal, pretracheal, paratracheal, and the retropharyngeal. Now we will look at the lymph drainage areas. So if you look at the head, the face, and the scalp area, the scalp does not have any lymph nodes. Okay? They have lymphatic vessels which drain this area, but they don't have any lymph nodes. Okay? So if you take the face area, it drains according to a triangular shaped or wedge-shaped areas. So in this area, which includes the chin, the lower lip, and the lower teeth, the lower two incisors, they drain into the submental nodes like this. Right? Then the area, wedge-shaped area behind that is the anterior scalp, the nose. You have the frontal, maxillary, and ethmoid sinuses, the upper lip, the cheek, the anterior cheek region, and the other teeth except for these incisors, they all drain into the submandibular glands, right? And then more posteriorly, you have the anterior scalp, the parotid gland here, the area of the cheek above the parotid gland, all these drain into the parotid lymph nodes. Right, and then an area behind that, the scalp above the ear, you have the ear and the auditory canal, and this area they drain into the mastoid lymph nodes, and the most posterior area of the scalp drain into the occipital lymph nodes. Right? Here you see how they drain according to wedge-shaped areas. Right? Here you have the submental nodes, and then the submandibular and the parotid. Here you see the post-auricular and the occipital areas also. So all these areas finally drain to the deep cervical lymph nodes. Okay, so this horizontal group of lymph nodes drain to the deep cervical lymph nodes. Then we will look at how the tongue drains, right? So the tip of the tongue, it drains into the submental lymph nodes. It's easy to remember. Now, when you take the anterior 2/3 of the tongue, except the tip, the most lateral areas, the lateral halves, drain into the submandibular nodes on the same side. And the middle area, the medial area, they drain into the submandibular nodes and the deep cervical nodes on both sides, right? So this side is the left side if we are looking at a patient. So this can drain into the deep cervical nodes of the right side and the left side. It's similar on the other side. And similar to that, the posterior 1/3 of the tongue, it drains into the deep cervical nodes on both sides of the neck, right? So it doesn't matter on what side a lesion is, it can drain into the other side as well. So you can't decide which side the lesion is depending on which side lymph nodes are enlarged. I hope you are clear about that. If there are any clarifications to me, please ask, okay? So I have included a chart including the lymph nodes, the location where they are found, and the structures which are drained into them. You can go through them. Then the final lymph drainage pathway. So all the lymph drainage from the superficial areas and the regional areas, they finally drain into the deep cervical lymph nodes, right? And then they will drain into the jugular trunks. And these jugular trunks on the right side will join the right lymphatic duct, and on the left will join the left thoracic duct, which will join the junction between the internal jugular vein and the subclavian vein, like this. So you have the lymphatic ducts here, the jugular lymphatic trunks. They join the right lymphatic duct on the right side. This is the right lymphatic duct which drains the right side of the body. And on the left side, you have the thoracic duct, right? So the jugular lymphatic trunk joins the thoracic duct, and they join the venous system at the junction of the left subclavian vein and the internal jugular vein. Okay, so can someone tell me what are the reasons for the lymph node enlargement? Anyone can answer?
Infection, madam.
Infection is one reason. Another reason?
Cancers?
Cancers, yes. Very good. So you already know these things, right? So if you consider the enlargement of lymph nodes, they can be due to infections of the structures which they are draining. So they can be a viral, bacterial, or parasitic infection. So for example, the submandibular lymph nodes may be enlarged if there's an infection in the maxillary sinus, like that. Then there are some infections which directly invade the lymph nodes, like tuberculosis. So in these cases, there is infection of the lymph nodes directly. Then there will be ulceration. That means like there will be wounds on these lymph nodes. Then if we consider the cancers or the tumors, they may be primary tumors. That means the tumors of the lymph nodes themselves, right? So they can be lymphoma, cancers of the lymph nodes themselves, and leukemias, cancers of the blood cells, mainly the white blood cells. Then lymph nodes can also be enlarged due to draining cancerous areas. That's called metastasis, right? So metastasis, secondary tumors can occur of these cervical lymph nodes due to cancer of the nasopharynx, tongue, and the skin of the head and neck. And also another cause of enlargement of lymph nodes is autoimmune disorders. That is, the immune system doesn't work properly in these patients and starts attacking their own cells. So this occurs in conditions like systemic lupus erythematosus and rheumatoid arthritis. Okay. So examination of cervical lymph nodes is very important, and in almost all patients, you should do the lymph node examination. So as you already know, in diseases of the head and neck, you have to check the lymph nodes, and also some organs of the thorax and the abdomen also drain into these lymph nodes, causing their enlargement. So it's important to know how to examine the lymph nodes of patients properly. Now, surgeons have divided the lymph nodes into different levels. Actually, they have named it as different levels. They are mainly in cancers. To remove the affected lymph nodes, they have named these areas. So level 1 here is the submandibular region. Then 2 is called is this area, and up to the level of the hyoid bone, right? From the base of the skull to the hyoid bone. Then level 3 from the hyoid to the cricoid area. Then level 4 from the cricoid area to the clavicle region. Then level 5 is the posterior triangle of the neck. Then level 6 and 7, 6 is the visceral lymph nodes, and 7 is goes a little bit below to the superior mediastinal lymph nodes. Now, can someone tell me, if a surgeon has to remove this level 5 lymph nodes, what nerve can be affected? Have you learned about the triangles of the neck? Anyone? Just
accessory nerve?
Yes, the accessory nerve crosses the posterior triangle, right? So in most cancers, you have to do block dissection of the lymph nodes of the neck, and in this circumstance, mainly the accessory nerve can be damaged. Okay, so little homework for you. I have put a little clinical scenario about a 65-year-old male chronic smoker presented with a non-tender hard lump on the side of the neck. This is the lump. So the doctor examined the patient as to see what the cause could be and noticed the white patch on the right lateral aspect of the tongue. Try to explain the anatomical basis of this. What do you think? What if we have some time, right? Yes. What do you think happened to this patient? Can you work it out? Anyone? So what do you think this is?
Madam, are they the enlarged jugular omohyoid lymph nodes?
Yes, this is the jugulo-omohyoid lymph node. It's enlarged, and usually when the lymph node enlargement is due to a cancer, they are non-tender. They are not painful. That means to touch, it's not painful, and it's very hard, not soft. If it was an infection, it will be tender, right? That is, it will be painful. So this was non-tender enlargement of the jugulo-omohyoid lymph node. So here, the patient was found to have a lesion on the tongue. This is most probably a cancer. So this may have drained to the submandibular nodes because it's on the lateral aspect of the tongue. First, they drain into the submandibular nodes of the same side. And then from there, they have drained into the deep cervical lymph nodes, mainly to the jugulo-omohyoid, causing its enlargement. Right? Okay, so as a summary, we learned about all the groups of lymph nodes of the head and neck area, then about the drainage areas, the pathway of the drainage, and a little bit about the clinical correlations. Okay, so thank you.